Hello and welcome to Group 2's Interprofessional Initiative. Our initiative is centered around the healthcare shortage and how a team-based model of care should be implemented in order to help combat some of the negative effects associated with the shortage. So currently, there are about 9.7 million people who are employed as healthcare workers, and that number is going to need to increase over the next 5 years. But based off the current trends, it is projected that that number will actually decrease. So therefore, we're going to have a shortage where we're going to need more healthcare workers than we currently have. And that in the next coming years, that is going to continue to increase in that shortage. And down below, you can see there are some cause and effects relationships associated with this shortage. So some of them include lower quality of care, time constraints for doctors, you have prolonged wait times, increased prices, medical errors increase, and so on. So this is what our interprofessional initiative comes into play. For us, it is to promote a team-based model of care during the healthcare shortage to improve issues associated with the shortage. We hope this initiative will encourage healthcare workers to take courses and complete trainings that will strengthen one's individual and team level work. It has been well documented that a team-based model of care is an appropriate system for our healthcare workers and that it actually helps improve various negative associations that come into play due to this shortage. One example of this is in this Team Steps program. There's this article and they did a study where they found a positive relationship between teamwork and quality and safety in inpatient care. So as teamwork increases in the healthcare system, so does quality of care and safety for our patients. This idea is also extremely similar to that of the one from the TED Talk that we watched from Dr. Atul Gawande, where he emphasized the need for teamwork in our healthcare system, as well as a checklist, which this article also did a really good job of talking about and explained how that checklist is needed and can help encourage that system further. Another piece of supporting evidence that we found is a team-based model of care research article. So from this research, they found that a team-based model of care not only improved patient health and safety, but it also improved provider satisfaction. This means that providers experienced less burnout and less of those negative effects that are associated for them for working a lot of overtime and just having that shortage of people in their working system. So all these areas, again, that are typically negatively affected by the shortage are being increased and promoted in a positive manner due to that team-based model of care. So for us, we think the biggest impact that we would have on this is helping healthcare workers be aware of the shortage and all the negative effects that it has on them, as well as the patients around them and the patients that they're helping to serve. So by taking further education courses and further training as a group, it will help promote not only better patient care, but also help promote a better work life for these healthcare workers who are struggling during this time of the shortage.